Today is November 10th, 2015. Kay Wagner and Sarah Battison are with Dr. Bob Caplan, retired endocrinologist and internal medicine physician. Dr. Caplan joined Gunderson Clinic in 1969 and retired in 2014, a tenure of 45 years. Thank you for being here with us today, Dr. Caplan. To start off with, could you tell us a little bit about your family history, where you grew up, your education and training?
I was born in Chicago, but at an early age we moved to a western suburb of Cicero, and I went to J. Sterling Morton High School, which was a very large high school. I think our graduating class was 600 or 700, and my mother and father both came from educated families, but unfortunately, depression had very significant problems for the family, and neither one of them graduated high school, although my father, after helping out his family for a few years, went back and got his high school diploma. But both my mother and dad were absolutely convinced that my brother and I were going to get an education, no matter what it took. And it took a lot of sacrifices on their part. And the other thing about Cicero, it was a kind of a working class city, and many of the people had the same attitude towards education as my parents did. That is, they worked hard, they made personal sacrifices so their kids could get an education. So that's kind of the background that I came from.
And piggybacking on that a bit too, as far as wanting to be educated and do well, did that factor into your decision to become a physician? Was it something that your folks kind of encouraged, or was it a field that you were interested in early on?
Well, I was saying my parents really were very inclined to have us educated, and one day I can remember my dad came up to my brother and I. My brother was 11 months younger than I was, but we went to school together. And he says, listen, you guys, he says, I think one of you should become a doctor and one should become a lawyer. He had a lot of doctor and lawyer friends. And I thought that was a terrific idea. But my brother didn't think the law was for him. I wanted to be a doctor, and I never wanted to be anything else since that time. I read all these books, The Citadel, Not as a Stranger, Aerosmith, and it was, from that day on, that's all I ever wanted to be. And of course, like young people are, I never thought that there was any chance I couldn't do it. So that's where I got the idea of being a doctor, and went on from there. Now, my brother became a physicist. He was a professor of physics in Kansas, but his attitude towards my dad's suggestion was the exact opposite, and I'm glad I did what I did.
Was there a particular mentor or role model who inspired you while you worked to become a physician?
Not really at that time, but a mentor and role model and a hero to me was Dr. Overholt. Years later, after I had gotten my medical degree, because he was such a great clinician and the director of medical education at this institution for so many years, I would say of all the people that I've had relations with in medicine, Overholt by far and away was the most important.
Did he have a role in how you became interested in working in lacrosse?
Yes, he did. After I finished my residency at the University of Colorado, I went into the Army. And I was married about a month before, so our honeymoon was at Fort Bullis in San Antonio, Texas, in about 110-degree heat. At any rate, we were sent to Korea, and when I was in Korea, I made people who became my best friends throughout my lifetime. In fact, we get together once a year for a little reunion. And among those people was Rudy Kaimowitz. Now, Rudy was a hematologist who practiced here. So I knew him, and then when we went back after my stint in Korea, I was at Fitzsimmons Army Hospital, where Colonel Overholt was my chief. And Rudy Kaimowitz also was sent to Fitzsimmons. So I knew those two. Then I went into my fellowship back at the University of Chicago, where I got my medical degree. And in 1968, the Democratic Convention was being held in Chicago, and we were expecting riots, and in fact, that's what happened. It was a very raucous convention, as older people will remember. In any case, we wanted to get out of town, so my wife said, let's go visit the Kaimowitzes. I think they're in La Crosse. I didn't know anything about La Crosse. I didn't know anything about the Gunderson Clinic. But Rudy said, yeah, we'd love to have you come, and by the way, we're looking for an endocrinologist. Well, at the time, I'd never been in a city smaller than Denver, and I was a little concerned about a job in what I thought at the time was a family clinic. But they threw a party for me, and I met with Bob Rasmus and Adolf and Sig Gunderson, and Ed Overholt, who had retired from the Army and now was the Director of Medical Education. Well, in any case, at that party, they were very enthusiastic about the education program they were starting. And this fit into what my ambitions were. I wanted to practice endocrinology, and I wanted to be able to teach, and possibly maybe some bedside-type clinical research. And this was, we were so impressed with the possibilities of meeting all of my ambitions that we said, boy, we've got to look at this place a little more carefully than we thought. Well, we went on to visit other big clinics, Lovelace Clinic in Albuquerque, Virginia Mason in Seattle, Permanente in San Francisco, places out west because I had interned in the west at Highland Alameda County in Oakland, California, and then the University of Colorado. So I was very interested in the west. But none of those places really seemed to fit with what I was seeing at Gunderson. The other thing is, on our visits to these big clinics, very frequently my wife was left for 2, 3, 4 hours sitting in a waiting room as I was being shown the clinic. Nobody paid any attention to her. But at our visit here, she was taken around to see the community, the schools, all these things that a woman would be interested in. So this fit everything we could possibly want, a potential career with endocrinology and teaching, and a welcoming environment for raising a family.
Was there someone, probably maybe besides Dr. Overholt, that pushed you competitively, helped to make you a better doctor, whether it was here at Gunderson or elsewhere?
No, I really think Overholt was the most influential person in my career, and for a number of reasons. Not only was he an outstanding clinician, he was an outstanding teacher, but he was 30 or 40 years ahead of his time in terms of the economics of medicine. He recognizes back then, 50 years ago, that we were wasting too much money in medicine. And he emphasized economy. One test, if that will give you the diagnosis, rather than a dozen. And I think even today, the Gunderson's healthcare success is partially related to the fact that we have been efficient and economic. So I can't think of anybody else. Well, let me take a step back. There was another person who influenced me, and that was Dr. Leslie DeGroot, who was one of the country's leading thyroid specialists. And he came to the University of Chicago during my second year of fellowship. And he gave me a lot of opportunities in research when I was finishing up my fellowship. So I should say that he might be the second one who influenced me, and in fact stimulated my interest in the thyroid, which was a number one interest of mine throughout my career here.
He's published. He's published too. DeGroot, hasn't he?
Oh, he's published many papers,
and
yes.
even textbooks, I believe.
Yes, yes.
Well, I think we talked a little bit about how did you come to Gunderson. You know, I think we've talked a little bit about that, but do you remember what number you were in terms of?
I do. I was number 60.
You were number 60.
And the clinic building was 2 stories high. So it shows you how small it was at that time.
Talk a little bit more about your interest in medical education. I know you've mentioned that, but it's besides medical education and also research, you were very interested in both of those.
Yeah, when I came here, Dr. Overholt invited me to serve on the education committee. And the residency program was getting started, and we had a number of very bright and enthusiastic residents. And this was perfect for me. So I spent a lot of time in education at that time. And as far as research is concerned, I had a project in mind when I was still a fellow that I never really got a chance to get started on. And that had to do with the effect of the high iodine content of the American diet influencing thyroid function testing. And so after I was here for a few months, I asked Richard Kujak, who is one of the laboratory technicians, if he'd like to do the study. He says, sure, he'd like to do it. So I then went to Dr. Overholt, and I think either Sig or Adolf Gunderson, and I told him I need a little bit of money for this. And it didn't take him more than a couple of minutes to say, go see Bev Sturridge, she'll write you a check. And so research in those days was very simple. We can't do that now. Of course, we have to have a education committee and follow government regulations and so forth. So it's more complex. But my point is that I was able to get this project going very quickly. I got the cooperation of a laboratory technician, and in a year we had it finished, and it was published in the American in JAMA, Journal of the American Medical Association, and it really continued to whet my appetite to do that kind of a research. And in fact, we did find that the content of the American diet had made dramatic changes in this test, and it helped make this test continue to be important in diagnosis for a few years. My hope that I would have a career not only of clinical care of patients, but in research and education, it became true, and I was very grateful for that.
Your publication resume is one of the most extensive in Gunderson history. In fact, I think Dr. Eric was saying that you're the third. You have the third highest publications for the system, which is quite impressive. And I was looking through it, and you mentioned, I saw the different studies about iodine and the hyperthyroidism and that type of thing. Did you have a particular day that was allotted to doing research or writing?
Yes. After I was here a year or two, and people saw I was regularly publishing a paper, I forget now who was the head of research. Probably it was Dr. Overhaul. And he said, we see that you've been somewhat productive. And they gave me a half a day a week, which was not a lot, but it made a big difference in my ability to continue to do research. So, yes, I did have a half a day to do that, and that was very useful.
What would your colleagues say that you are known for?
Uh, I I think they would probably say I'm known for keeping up with endocrinology despite a long career. I think there's a tendency for people to read less and less as they go on and kind of continue to do things as they've always done them. But you can't do that in endocrinology. The changes are intensive and constant. So I think I did keep up, and I think people recognize that through the years. And I think they might have also recognized me for being pretty even tempered. I was not hard to get along with. And that's another thing, by the way, that I enjoyed about this clinic. Not only did I have very competent colleagues in all areas, but they were very congenial. I can't think of a disagreement I've had through my 45-year career here with my colleagues. So that was another thing that has made my career such a great satisfaction.
I wonder what contributes to that congeniality, if it's something that has, is fostered, from the ground up, or just the people that are chosen to work in the environment be kind of an
It's
interesting.
probably a combination. I think that this congeniality probably goes back many years, even before I came here, and it's continued through the years. Whether there was direct attempts to recruit people of that nature, I'm not sure, but it certainly was the case, at least from my perspective.
It somewhat likens to being part of a family
Yes,
in
yes,
some ways.
indeed. In fact, I had a colleague many years ago who developed problems with depression. And I remember how hard the clinic worked to help him out. So it was very definitely a kind of a family atmosphere.
Well, you mentioned earlier that endocrinology is a field that's just moving and changing continuously. And do you have any specific innovations or highlights that you've witnessed?
I think there are two that come to my mind. One, with the radioimmunoassay, a technique that allowed for the measurement of very tiny amounts of hormones in the blood. That dramatically changed our ability to diagnose diseases. So the ability of that technique and subsequent technique to measure tiny amounts of hormones in the blood and other body fluids was one major advance. The ability to scan the endocrine organs and to actually visualize them without operating on the patient. And finally, the treatment of diabetes has been dramatically improved over the years. When I was a medical student, all we had for diabetes was one or two types of insulin and maybe one pill. Now we've got all sorts of treatments that have prolonged the life and improved the quality of life for diabetic patients. Diabetes 50 years ago was had a very dismal prognosis, but now it has an excellent prognosis, and that's due to the development of many drugs.
Who else on staff was practicing endocrinology when you came to Gunderson?
When I came, Dr. Ed Miner had a small role in endocrinology. I think he would admit that. He was interested in other things, but he did have some training, as I recall, in bone disease. But basically, I was really the first full-time endocrinologist.
Do you have any favorite stories about Gunderson in your practice? Maybe favorite patient, worst day, little things that pop into your head when you think about your years here?
I think there was one dramatic patient, It was in 1976. Dr. Lathrop came up to me, and he says, "You know, I've got a friend up in northern Michigan. She's only 30 years old, but she's been sick and seen many doctors. They haven't been able to make a diagnosis. I think it's something endocrine. Would you see her?" And I said, "Sure, I'd be happy to." So she came up, and the symptoms she was having was that she was sweating, she was fatigued, she had periods of depression. She noticed that her hands and feet were swollen. In fact, her shoe size went from about a 6.5 to 8. And when I looked at her, she had what we call acromegaly. Acromegaly is due to a benign tumor of the pituitary gland that's making too much growth hormone. So that and the diagnostic studies showed that that's what it was, but there was no tumor in the pituitary when we did a CAT scan. In addition, she had a big mass in her abdomen, and we thought that that was probably a cyst in the pancreas from an auto accident she was in. So the intern who saw her says, "I think she's got growth hormone production in a pancreatic tumor." I'd never heard of this, but he was persistent, and thank God that he was. Because what we did is we decided we're going to take out that mass in the abdomen first, and then send her to the Mayo Clinic to have the pituitary gland operated on. At that time, in 1976, we were not doing pituitary surgery because Dr. Sheely had left the clinic. And he was, actually, at the time he was here, he was the country's most experienced neurosurgeon in pituitary surgery. So there was a fairly brief interval when we were not doing the surgery. So we were going to send her to the Mayo Clinic for that. Well, we took out that mass, and it turned out to be a tumor of the pancreas, like the intern thought. And fortunately, he asked the pathologist to freeze the tissue and to freeze extra blood and whatever fluids were available. So they were frozen right at the time of surgery. The day after this tumor of the pancreas was removed, this lady, and as I was making rounds, said, "I haven't felt this good in 3 or 4 years. My hands aren't swollen. I just feel terrific." I said, "Gee, that's strange." But we know that successful pituitary surgery in acromegaly, the patient very quickly feels better. And I said, "Gee, maybe his intern was right." So I called Dr. Randall at the Mayo Clinic and says, "Look, we're going to take a little bit of time and restudy this lady." To make a long story short, everything returned to normal. But again, to make the story a little shorter, it was not growth hormone in the tumor. It was a substance that the tumor was making that caused the pituitary gland to make too much growth hormone. So this case then was written up with the help of a number of well-known researchers around the country. We didn't have the facilities to study something, but we had the tissue and we had the blood. And so this became a rather important case report of what's called ectopic growth hormone releasing hormone production by a tumor of the pancreas. It was published in the American Journal of Medicine and subsequently reviewed in several yearbooks because of its importance. So of all the cases I've seen, and the most important thing, of course, is that this lady was cured. And so that's the most important patient that I can remember.
And did the resident go on to practice elsewhere?
Yes, he was he became a surgeon, and I've kind of lost track. But I credit him with his thinking and preserving that tissue. Otherwise, we couldn't have proved any of these things.
Was that another example of the benefits, maybe, of having a medical education program running?
Absolutely.
If there was something you could have changed back at the time that you were practicing, is there anything that you can think of that might have made a better place?
I haven't really had any thoughts of improvement because things have been improved from our leadership throughout the years that satisfied me, and so I don't have anything that I would have done any differently.
You were part of the integration of the clinic and the hospital, which has been a wonderful thing in the long run. It was a little bit of a tough transition at some times, I think.
Yes, but it's grown
Yes.
progressively, and I think is one of the great medical institutions in this country.
When you think back to that party that they had when you were being recruited and didn't even know you were being recruited, if you will, was there a vision that you heard even back then for the growth of the clinic and the hospital as it?
We didn't talk so much about growth, but we did talk about the teaching and the residency programs, which of course I think was critical for its growth, and also about the potential for increasing research. Because although research was being done, there wasn't very much of it being done, and now of course it's grown exponentially.
Well, even this year, Dr. Linda Smith suggested that as part of the archive efforts that we're doing, that we highlight publications of the institution. And Dr. Eric picked 2014, and there were 93 publications that came from the Gunderson staff.
Wow, I didn't know that. That is remarkable.
Yes, and so we're highlighting 10 of those in one of the displays that we have in that legacy corridor. So that's just another way of exhibiting how much that means to the institution and how it promotes the research that we're doing.
And it helps recruit top-notch people, both for the residency programs and for the staff.
Absolutely.
There were two departments that were very important to my career, and in fact, to the entire medical center. That's the medical library and medical media. When I first came to the clinic, I was asked to serve as a representative to the medical library. And at that time, the library was small, but still very good. Mrs. Laverne Sam was the librarian, and she was very quick to introduce information technology to the library. And when she retired, Kay Wagner followed through, and so we've had a very sophisticated library. In fact, I think one year it was voted the medical library of the year. The other department was medical media. That was important to me for both teaching and the research aspect of my career. That was started by Joe Teat, who came from Madison, where he was involved in medical media at the University of Wisconsin Medical School. And he increased this small department to a very big department now that's important for patient care, education, research, and frankly, marketing. So I just wanted to mention that those two departments were very important to me.
Were there any last thoughts that you want to share, or that as you were preparing for the interview or thinking about it, you?
There is another vignette I might give you. In my early days, I took care of a lady who had breast cancer, and she developed a very high calcium level. And we got the calcium level down, but being elderly, that did affect her mentally. And it would have taken, in my estimate, a week or two more of recuperation before she could go home. And I recommended she go to a nursing home because she was fine. She just needed a little bit more time to recover from this metabolic insult. And one of her relatives came from out of town, and she was absolutely incensed with me that I would send her to a nursing home. She says, "I want to talk to a Gunderson right now." And I said, "Sure, that's fine." And I called Adolf Gunderson. And I was pretty new at the time. And she told this story and accused me of a lack of sympathy and empathy and so forth. And he got about that far from her face. And she says, Dr. Caplan is one of our best clinicians. If he thinks she'll benefit from a nursing home, then that's where she's going to go. And I was really surprised because this was in the early days when keeping people in the hospital for a week or two extra was not that uncommon. But I've never forget the loyalty that he demonstrated, and my prediction was absolutely right. In a week or two, her mental state cleared up. She went home, and that was the end of it. But the easy way out was to say, "Sure, we'll keep her here," and that's not the way he saw it, and I've been forever grateful for that.
Anything else that you'd like to share with us?
I think that's it.
Well, we sure appreciate you coming in, and it's been wonderful to listen to your memories and find out, what brought you to Gunderson and all the things that it meant to you in your practice.
Well, thank you, and I appreciate the invitation.
Well, we are delighted, and thank you for the contribution you and your wife have made to Gunderson over the years.
Thanks a lot.